Mohon izin untuk Bapak Ibu sekalian untuk mendengarkan terjemahan langsungnya bisa login ke Zoom, aplikasi Zoom. Di situ nanti ada ikon gambar bola dunia, nanti dipilih saluran bahasa Indonesia. Ini ada terjemahan langsung.
We're ready? Yep, perfect. Thank you. So, for this presentation, I will talk about two cases of Mexico and Asian countries, but I will start with a little of introductions about the importance of rabies control. That we will talk about this. We talk about this in the morning. So, rabies is almost universal fatal when symptoms appear. Annually, it causes about 59,000 deaths worldwide. Controlling rabies through vaccination, post-exposure prophylaxis, and education can save countries' life. Treating rabies after exposure is costly, and the psychological trauma for bite victims can be significant. We saw these pictures and you can imagine the psychological trauma for that people. So prevention strategies like dog vaccination and rabies prevention education are most cost-effective than post-exposure treatment. Rabies affects not just domestic animals, also wildlife, leading to significant animal suffering and death. Vaccinate animals, especially dogs, which are the main source of human rabies cases, can prevent its spread. Rabies is one of the neglected tropical diseases targeted for elimination. Organizations like World Health Organization, the Food and Agriculture Organization, the World Organization for Animal Health, WA, before known as OIE, and the Association of Southeast Asian Nations have set the goal to eliminate dog-mediated human rabies by 2030, including Indonesia. So we have different stakeholders that is very important to take in account for the programs. For example, the government officials and policymakers. So they can pass and enforce laws, require animal vaccination, regulate stray animal management, and addressing the dog meat trade to help eliminate rabies. Governments play a pivotal role in financing rabies control programs, providing resources for mass vaccination campaigns, education, and post-exposure prophylaxis distribution. Policymakers can work with international bodies like WOA and WO to meet global rabies eliminate goals and implement multi-sectoral approaches. Veterinary and public health leaders are crucial in leading mass vaccination drives and monitoring vaccination covers in terms of companion animal and domestic animal population. They play a role in detecting rabies outbreak, reporting cases, and coordinate a rapid response to potential rabies cases in both animals and humans. Health professionals must be trained to recognize rabies symptoms in humans and animals and know the appropriate protocols to bite victims. Community leaders and local influencers, as village elders, religious figures, or respected community members, can encourage pet owners to vaccinate their animals, report rabid animals, and take bite victims to healthcare centers promptly. They can also influence behavior change by promoting the importance of keeping pets vaccinated and sterilized, preventing free roaming of dogs, and keeping dogs safe from the dog meat trade, as well as educating about animal care. NGOs and international organizations help advocate for rabies control and elimination, fund vaccination campaigns, and support rabies education. These organizations often provide technical expertise and logistical support to national and local rabies control programs. They facilitate cooperation between health, veterinary, and education sectors for integrate rabies control efforts. So, can you put the next slide, please? Yeah. Where is this? Can you guess? Could you guess where is this? Any idea? Mexico. That's right. Next, please. Yeah. This is part of my country. We have this beautiful beach, but also Mexico has these communities that are very poverty. We have a lot of communities, indigenous communities. They don't speak Spanish. I told you they speak Maya, they speak Nahuatl, Zapoteco, Mixteco. There are languages that they don't speak even Spanish, and they live in remote areas, in the mountains, or in very difficult access places. So this is important because I think it's very related that your country has the same issues. You have these beautiful places, very touristical, and a lot of nature, a biodiverse place, but also you have a struggle with a lot of stuff. But even with all that, Mexico is free from human rabies transmitted by dogs. In the 11 November 2019, the World Health Organization declared Mexico the first country. Can you put the next? Thank you. We have the validation for eliminating dog-mediated human rabies as a public health problem. So we have some cases. This year we have one case, but was a cat in a very remote area. And we have another case, but was the rabies case for these kids was they were playing with a bat that has rabies. But we don't have cases in 25 years for people from rabies from the dogs. So how Mexico achieved this free status, rabies-free status? Next. So we have this program, and this program includes free mass vaccination campaigns for dogs and cats. We have 2 times a year free vaccination for all the animals, and indeed the police, the military, the medical people, doctors, veterinary students, veterinarians, even medical students, they go out maybe sometimes door to door to put the dog mass vaccination in place. Also, we have public awareness raising campaigns. We talk a lot about animal behavior. I'm a behaviorist, and we work with the people about saying the animals, they always do the stuff for a reason. There are no machines. If you read the language of the animal, and if you see the animal is maybe dominant, or maybe it's afraid, or maybe he has pain, and you touch the animal, he will bite. But if you don't do anything for cause fear or anger to the animals, they don't will bite. So it's important for people to understand animal language, how the tail, the ears, this small stuff, like for example, if they lick their own lips like this, that's a very nervous animal, and he's trying to say, please step back. But if the people doesn't understand this small talk that the dog is doing with us, people continues to trying to touch the animal or wherever, and they will be bitten. So we have an effective surveillance, timely diagnosis. We have the availability for post-exposure prophylaxis, and for people like veterinarians, we have prevent rabies vaccines. So Dr. Carissa of the Pan American Health Organization said in this event that Mexico, we declare free for rabies, says that by eliminating, one back, no, yeah, thank you. By eliminating human rabies transmitted by dog, Mexico is showing the world that ending infectious diseases for the next generation is possible, and this is the right way forward. Next, thank you. So we don't stop in 2019. We still continue with these programs. This is the campaign poster for this National Week. And we will have in Mexico on Monday a forum like this for World Rabies Day, and I will talk with my government about cat behavior also. We have this coloring book for kids, and we work with schools, we work with veterinarians, and we continue raising awareness of animal behavior. Next. So what is doing HSI in Asia, for example, for continue to working against rabies? So I have a video. Can we see the video? You are ready?
The Humane Society International and the City Veterinary Department started working together in 2016. They came at a time when Quezon City was at its worst in rabies occurrences, consistently 28 to 29 cases per year.
One of the challenges that we're facing here in Quezon City during our vaccinations, how to convince homeowners and pet owners to vaccinate their animals, especially the dogs and the cats. Libreng bakuna sa aso at pusa, tao po!
Mas marami pa rin po ang hindi nakakapunta sa barangay dahil yung matapang yung aso, hindi matalino.
We go to far-flung places just to vaccinate the animals. These are small alleyways, roads, and places that are hard to reach. In order for us to overcome this challenge, maximize the capacity of every person per team, we're doing house-to-house vaccinations. Each team is composed of around 4 to 5 people, and each person is capable of doing a specific role during the vaccination. And most of them are really capable in what they do. So we have a complete trust for our vaccinating teams, and each day we could accomplish around 1,500 to 2,000 animals of vaccination.
The HSI put a system in our vaccination practice. Using their mobile application, target areas were accurately covered.
This phone application records every vaccination for dogs and cats. It's been very useful since it generates reports directly into the map and into a spreadsheet.
Quezon City now has reached a higher level of vaccination coverage, which is 50% of the total dog population, a statistics we never imagined we could attain.
Because of this MDV app, we were able to cover the entire barangays, the entire district. And these have been very helpful for us, especially for Quezon City Veterinary Department.
HSI accomplishments are marked by patience, hard work, and dedication, thus yielding favorable results.
By the next few years also, maybe we could reduce the number of human deaths and animal rabies cases here in Quezon City.
Controlling the disease in dog is the most cost-effective way to prevent rabies in humans.
Next, thank you. So that was an example. We have also helping in India um, with vaccines, and we have an app that we can use so we can mark if the animal in one street is already vaccinated. So we took a picture of the animal and take the Google Maps coordinates so we can know in which areas we have the vaccines and which animals are vaccinated. Next. So we are working also in Vietnam. Mexico and India doesn't eat dog, or some places in India, but not in all. But Vietnam has dog meat trade and has also rabies problem. So we are working in that country because we have information. This is one of the studies that make in 2011 about the evidence of rabies positive dogs being trafficked, slaughtered, and sold for human consumption. And this rate of rabies in these animals is high as 16%. The movement of different strains of rabies virus in dogs being traded for human consumption has also been tracked. So people, I last one back, yeah, thank you. So people that work in the industry have a high risk exposure during the slaughtering, butchering, and handling. And this exposure is considered a category 3 rabies exposure. So this category is the highest, and the treatment has to be immediate with vaccines and antibodies. In Vietnam in 2017, they have an outbreak and they have 30% of human deaths linked to exposure during the slaughter and butchery of dogs from the dog meat trade. So yeah, next. Dogs are illegally transported across international and provisional borders, so this complicated more the problem with the rabies in Vietnam. These animals are unvaccinated and unquarantined, and usually the papers are falsified. So the people have high risk catching, handling, skinning, or preparing dog carcasses. And obviously, we have a high cost of post-exposure vaccines. So this is another study made in 2016 for the government. As you can see, we have 200 samples, and they have 4 positive animals from rabies. Next. Thank you. So HSI is working with Vietnam government promoting dog and cat mass vaccination and closing dogs and cats slaughterhouse. I had the opportunity to be there on July for one of the rescues. So we want to work with the government, and also we work with the producers or with the the owners of the slaughterhouse. So we buy the animals, we provide this money for they have another kind of life, more secure for their family and cruelty free. So for example, in this case that we close the slaughterhouse, the cat slaughterhouse, the owner now will use the money for grow tea and guava. Next. So I think maybe seems very complicated to change the culture of one place, but it could be. In South Korea, they don't have rabies, but they used to have dog meat trade. They consume dog and cats, and in 2024, we passed a law, and South Korea now is dog meat trade free. So it's possible. It's possible. So maybe it looks very complicated. It's okay. The next one. So I want to congratulate you for having these talking and these discussions and these forums, because I know seems like very complicated stuff. My country is very similar than yours, So a lot of years ago, people just opened the doors for the dog, go outside, and they put it inside just for taking the bark at night to the strangers or something like that. But now we have a very pet-friendly place, very pet-friendly country, very safe about the rabies. So this is the great start for your country, and you can count with HSI further. Thank you. This is my other part of the family. Oh.